Are you thinking about getting Botox for the first time, but you're afraid? I don't blame you. I'm Dr. Sarah Allen, Chief Medical Officer of SkinClick. I always tell my patients before I got Botox for the first time, I probably thought about it for 5 years. I was afraid, I was nervous. You've never had this procedure done before, you don't know what you're going to look like. And sometimes you have a healthcare provider who may not be very understanding. They may not listen to your concerns, and you may not be confident in their skills, which only leads to your worsening anxiety about the procedure. I get it, and I've been there. And I knew there had to be a better way. That's why we started Skin Click. So here's what you need to know about Botox. Botox are also called neuromodulators. Basically, this is a fancy word that said your nerve affects your muscle. So Botox is a medication that's safe. It's been around, y'all, since the 1990s. And Botox is not only used for cosmetic indications, but it's also used for medical indications like vocal cord dysfunction, bladder dysfunction, esophageal, your swallow tube dysfunction, and many other things. So, how does it do it? Well, you deliver this medication and it actually travels to where your nerves meet your muscles. And there it does what we call cleave. It breaks a little protein. And because it breaks that, the little signal that normally goes to your muscle that says, hey guys, contract and move, it takes that out. And so your muscles don't move, they don't move as much. That's the whole goal of Botox. And because they don't move as much, your skin doesn't crinkle, right? Because you're not moving. And because of that, you don't develop deeply etched lines over time. So that's the whole premise of Botox or a neuromodulator. One question I'm asked all the time is one medication better than the other? The answer is no. They're just different. But I will say, if you prefer Coke over Pepsi, then you may be someone who has a love of a certain neuromodulator. But the truth is, I've used all six, I've put all six in my face. They all deliver results, and that's really what you're going for. I think what matters most is the skill of the person who is putting the medication in you.